Imetelstat is a new agent, is a telomerase inhibitor, and it is used in lower risk MDS patients because it is known that there is an increase of telomerase activity in this disease. Imetelstat has shown in a phase 2 study a 42% transfusion independence in patients who received the treatment for a long time. We have seen also transfusion independence longer than 1 year, and in some cases longer than almost 3 years of transfusion independence. So it's a very active compound. The patients that we studied in the phase 2 were patients with low risk MDS, either refractory, transfusion dependent, but not del(5q) patients, nor patients who had received lenalidomide or HMAs prior to this therapy. Now, the data I presented at ASH are relative to the on-target effect of imetelstat. So the drug is active, and in the patients in which it's so active, there is indeed an on-target effect measured as more than 50% reduction of hTERT expression. That means that more than half of the patients, something like 54% of patients, really experienced this significant reduction in hTERT expression. This reduction is not accompanied by an excessive myelotoxicity, and the patient who experienced this pharmacodynamic effect of reduction of hTERT had higher rates of transfusion independent and mostly longer duration of transfusion independence. Therefore, the on-target effect is quite clear. And also the patients who did not achieve a transfusion independence with an optimal pharmacodynamic effect have a greater reduction in transfusion of red blood cells, meaning that if you really, you can really with the imetelstat have an activity on the disease itself, on the dysplastic clone. So it is a very interesting observation. We are waiting for the result of the Phase III study that has just concluded, in which we will see in the same setting, in the same kind of patients, the activity of imetelstat, and the endpoint is transfusion independence longer than 8 weeks.